My name's Dr. James Hyslop, qualified in 1996. I've been in dentistry for 30 years now. I've been placing and restoring dental implants for 20 years. A dental implant effectively is the next best thing to a patient having their own tooth back, providing they have enough bone available in the jaw. It's a titanium screw that's screwed into the jaw and then restored with a prosthetic tooth to look exactly like a human tooth. It obviously provides exactly the same function as a natural tooth. It's just revolutionised the world of dentistry and my life as a dentist. One of the most common complaints is patients will come in and say that they are struggling to eat because they have dentures moving around that are ill-fitting, or they lack in self-confidence because their dentures move when they talk or they smile. Giving these patients fixed implant restorations, whether it be crown and bridge work or removable dentures on implants, can greatly improve their self-confidence, also their function, which can improve their diet and improve their health. When patients are anxious, we happily explain every aspect of the treatment. Patients who are anxious are very welcome to bring their partners with them. We have various visual aids, big screens where we can talk through treatment plans, so we can go through every aspect of the treatment required. I've had patients who've said on several occasions how their self-confidence was returned, and I've even had patients who said they've got a new job. There's just so much more self-confidence having a new set of teeth. One of the biggest things they say is they can now enjoy their food. Their diet has changed for the better. Probably the most important thing they say is they wish they'd had it done many years ago.
Before I had the implants, I had a lot of gum problems which caused my own teeth to be very wobbly, and I had to be careful what I ate. Now I have very secure implants and they're absolutely wonderful, the best thing I ever did.
Coming to the dentist was one of my worst fears. James has always put me at my ease. He's made me feel very, very comfortable. He's told me exactly what's going to happen, how long it's likely to take, and he's been good at his word.
It wasn't painful at all, and I was just delighted with the results. It just changed the whole way of how my teeth looked instantly.
The biggest misconceptions are that most people probably think they can't afford it. With various finance options we have in place, it can be very affordable with payment split over 12 months or 2 years. If you've been dealing with functionality problems or missing teeth is affecting your confidence, please contact us for an implant consultation to discuss your options.